So there's a couple of things to look for. One is just anytime someone's making indirect comments. So a lot of times people are not going to say directly, you know, I'm going to kill myself or I'm thinking about killing myself. They might say things like, I can't live with this pain. I can't live anymore with this sadness. Maybe they're making things about like, you know, well, maybe this family would be better off if I wasn't here. So really kind of paying attention to those sort of verbal cues. Behaviorally, usually things that you might see is someone acting different than maybe you're used to them being. So maybe someone who usually is very social and outgoing is isolating more and keeping to themselves. Sometimes they might have mood swings and go from being really angry to really sad. Giving away things. So anytime someone seems like they're preparing for something, like giving away prized items or making arrangements for their kids, things like that are things to look for. Also looking at what are some things that have happened recently in their lives. Are they going through any major stressors? So, you know, a divorce, maybe they lost their job, maybe they have a impending trial or something that they feel very ashamed about. Usually situations like that create the mixture for where someone feels really hopeless and helpless, and that usually was what will send someone into a crisis state where they might become suicidal. You know, if they feel like someone's in an emergency or that they're suicidal, take them to the emergency room or somewhere where they can get help. I know at Texas Health Resources, one of the things we put in place is a universal screening for suicide. So every patient who walks into one of our emergency rooms is screened for suicide. So it can help them get into the place to be able to access services. So they could speak with one of the crisis clinicians and help them get connected to resources. If you are noticing that someone is showing any of the cues or signs that they might be suicidal, then it's always best to just be direct and ask. You know, you seem like you've been sad lately. A lot of times when people are sad, they think about, you know, ending their life. Have you thought about that, or is that something you've been thinking about? Just being direct and creating that opportunity where it makes it okay for them to acknowledge that they're feeling that way. And then once they do start sharing, you know, just listening, being an active listener, making sure you're not showing any judgment, you know, making sure you're not saying things like, well, you wouldn't do something stupid like that now, would you? Because those sort of things would make someone start to shut down. So really being that support and there to listen to them and help them through can make a big impact. Let's say that they have said that, yes, I have been thinking about suicide. Help them get support. Maybe take them to the appointment. Help them look through different resources to find a therapist to talk to, or even help them with making their home safer. So that might be removing lethal means. So if they have access to like a firearm, maybe having a place for that to be kept away from them. So if they are feeling suicidal, it's not there for them to use. So removing those lethal means can make a big impact as well.